All right, welcome everyone to our first seminar this spring. And I would like to invite our director, the director of the Global Health Institute, to welcome you, and then I'll go over some ground rules, and then we'll kick off our talk with our guest speaker today. Dr. Chris Whalen.
Yeah, thank you, Juliet, and thank you everybody for participating in this seminar. This is the Global Health Institute seminar of Global Health. This is this series. It's every last Thursday of every month during the academic year. This year, with the advent of COVID-19, we shifted all of our speakers from, when was it, Juliet? Probably March of last year to the present, to speak about COVID-19 and its impact globally. Thanks to Juliet and her organizational skills, we've been able to accomplish that through this academic year. I want to thank Paula Davis-Owell, who is another member of the Global Health Institute, for her contribution to identifying speakers, particularly today. And I think the next one next month is another speaker from this, in this case, it will be, or next month will be Chapel Hill. And then John McCracken has joined us recently and has valuable input into the selection of speakers. And as we get control of the COVID epidemic, I think we will be migrating back to some of our other topics that interest us as a unit and may interest you. But for this semester, I will let Dr. Sikandi lay out what the plan is for our different seminars. And thank you very much for joining us.
All right, thank you so much, Dr. Whalen. We'll go ahead and, as you can see already projected on the slide, we have a nice layout of our speakers. The lineup is complete for all the 4 slots. Again, as Dr. Whalen mentioned, every last Thursday of the month is when we do these seminars, and this has been going on for the last probably 3, maybe this is the 4th year that we've been doing this, and the dates are up on the slides, the speakers, varying topics, but all connected and related to COVID-19. And so this is a seminar that we hope we can use to disseminate research findings, but also educate the UGA community, share information around global health issues. And so without any, so really our seminars, as far as we know right now, are going to be virtual until the situation kind of returns to normal, near normal. We used to have them in person, and that was great. We'd like to see you in person, but for now, we'll keep them online, and then we'll let you know as the situation evolves. And so today, our kickoff is really a very special one. We have a very special guest coming to us, really external from UGA. Sometimes we have speakers from UGA, but today, and for the most part, half of the seminars are going to be from external speakers, which is great. And so I would like to introduce our speaker today, and that's Dr. Chase Silva, who is a Senior Director of Policy and Thought Leadership at the World Food Program, USA. He's also a Senior Associate Senior Associate with the Center for Strategic and International Studies, Global Food Security Program. Previously, Dr. Silva worked with the United Nations Food and Agriculture Organization. He worked with the International Center for Tropical Agriculture, and also with a research program on climate change, and also agriculture and food security. So he has also consulted with the World Bank, Johns Hopkins, and Tufts University. His interests in the intersection of food security and conflict, humanitarian assistance, climate change, and sustainable agriculture. So Dr. Silva has also worked on food systems in 15 developing countries across Latin America, Sub-Saharan Africa, and South Asia. He has also led several major research initiatives, including the World Food Program USA, as winning Peace, Hunger, and Instability flagship report. So he has also served as an expert witness at the Senate Foreign Relations Committee, and his writing has been featured extensively in peer-reviewed journals. He has regularly lectured on food security at universities in Washington, D.C., and he also delivered a TED Talk on winning the long-term game in the fight to end hunger in 2018. So check it out when you have time and take a look at it. Dr. Silva earned his PhD from Oxford University. So a very great honor to have you, Dr. Silva, talk to us today. Please welcome him and please take the floor.
Great. Thank you very much, Juliet, and thanks for such a comprehensive introduction, and to Chris as well for kicking things off. Absolute pleasure to be with you guys, and pleased to be kicking off this series. I mean, I wish I can tune in for the other subsequent speakers, and maybe I will, in fact. Pleasure to be with you, though. Again, my name is Chase Silva. I'm the Senior Director of Public Policy and Thought Leadership at the World Food Program USA. And you kind of alluded to this, Juliet, but WPUSA is a nonprofit organization. We're based out of Washington, D.C., and it is our job to support the mission of the United Nations World Food Program in the American market. We'll talk a little bit about this, but the United States government is the single largest contributor to the United Nations World Food Program. And so we exist as an organization primarily to ensure that that support continues year in and year out. I spend a lot of my time today working with lawmakers up on Capitol Hill and educating them on what the United Nations World Food Program does and some of the emergencies that we're responding to, day in and day out. The other side of our shop at the WPUSA that you may see on your social media channels are primarily fundraising operation. We raise some dollars from private individuals, corporations, and individuals who also want to contribute their dollars or their expertise to support the United Nations World Food Program mission around the world. So that's what we do at the UN World Food Program. I started this kind of working the problem of hunger back in 2009 and 10, as Juliet mentioned, with a sister organization to WFP. Working with the United Nations Food and Agriculture Organization, and then spent some time with some agricultural research organizations around the world, but ended up ultimately back in Washington, D.C., which is where WPUSA is based. So, today I'm going to talk to you guys a little bit about the snapshot of global hunger around the world right now, and we're going to focus in on the effects of COVID-19 on that global hunger problem. Try to give you a sense of what's driving this, try to dispel a couple myths about global hunger in the era of COVID-19. I'll talk for 30, 40 minutes here, and then make sure that we leave enough time for some Q&A at the end. If there's anything super pressing, I'll try to keep my eye on the chat box down below in case something can't wait, and we can respond in real time to that. But Julian, I'm going to go ahead and jump in and share my screen. You just let me know when it's up and you can see it.
Yeah. It's right there. Mm-hmm.
Okay, great. So we'll do this, and you don't need this anymore. You know who I am, and you know what we're talking about. So let's jump right in. The World Food Program USA, like I said, is really exists to support the mission of the UN World Food Program. And I don't usually jump in front of an audience without at least giving you an introduction to what the UN World Food Program does. In my mind, this is one of the world's best kept secrets. I think over the last couple months here, the secret is out with the 2020 Nobel Peace Prize given to WFP, or awarded to the organization for its work in serving populations who are affected by conflict around the world, and for its work in trying to prevent the use of food as a weapon of war, has really helped to put the organization on the map and brought it into the sort of living rooms and social media feeds of Americans, all across the U.S. here. But the United Nations World Food Program is a truly massive organization. This is an organization delivering 15 to 20 billion meals. That's billion with a B every single year in 100 plus countries. We're serving between 80 and 100 million people in a given year. This is a pretty massive logistical operation, as you can imagine, right? A couple thousand trucks, 150 aircraft. This should be updated to 30 plus ships on the high seas, moving food from where it is really to where it needs to be. So tough to overestimate the size of this organization, its impact on the problem of global hunger. So it's such a pleasure to be working and advocating for this organization here in the United States, and to get to spend my time working with the frontline staff at WFP to make their jobs a little bit easier. So big organization, big budget. WFP is, we look back and roll back the clock to 2011, and the World Food Program globally was a $4 billion organization. And you can see over the past 10 years, those needs, those operational needs have climbed pretty dramatically. This year, the World Food Program with COVID-19 is looking at a budget or operational needs pushing $14 billion. Huge increase, 200% increase over the past 10 years. We're going to talk a little bit about the drivers of those increases in hunger, but just to say that big organization, a lot of budget. We never really meet these needs year in and year out. We'll talk maybe at the end about how donor governments are stepping up or stepping back in the era of COVID-19. We are expecting a budget shortfall this year of between $6 and $7 billion against those $14 billion in operational needs. So you can imagine, the number of hungry people that are going to miss out on meals this year because of that. So let's turn back the clock a little bit here. And a year ago, and I was talking to Paula at the start of the conversation, and frankly, this is a really good time to be having a conversation about COVID-19 and global food security, because many of the assumptions we made about COVID-19 and its effect on hunger have had time to play out over a 12-month period. What you're seeing here is a quote from the International Food Policy Research Institute, former Director General Shenggen Fan, and he was talking about COVID-19 back in March of last year and said, well, hey, this is a global health crisis, but it really has the ability to turn into a global food security crisis if proper measures aren't taken. And I think we can safely say, that kind of worst fear and prophecy has absolutely played out. We're going to talk about the numbers of people that we expect to be pushed into extreme hunger because of COVID-19 and the drivers. But suffice to say, there are a much larger hunger load today than we were facing, just 12 months ago. And a lot of it has to do with COVID-19 and the economic impacts in particular of the virus and the pandemic. At the time when Fan wrote his first article back in March of last year, there was about a dozen countries in sub-Saharan Africa who had confirmed cases of the virus. And the first case in Nigeria was, I believe, diagnosed in February 28th, so just a few days before he wrote that. And today, of course, the virus is in every country in the world. And this week, even though you don't see it here reflected in the data, we've passed two terrible milestones: the sort of 100 million cases and the 2 million deaths internationally. And so it's been a pretty profound impact on the world, this pandemic, and what used to be considered the sort of virus and pandemic of the West, heavily industrialized countries, is slowly making its way across the developing world. Now, today, we haven't seen the sorts of numbers and death rates and infection rates that we would have expected across large parts of sub-Saharan Africa at this point in the disease transmission. But suffice to say, there are certain places around the planet that are kind of bucking those expectations and showing similar to Western levels of infection rate. India, we've got 10 million cases and 150,000 deaths, for example. Latin America in particular has been hit in very put in very difficult situation by the virus, and we can kind of talk through the details of that. But back in April, about 2 weeks after, about a month after the executive director or the director general of the International Food Policy Research Institute wrote that message about COVID-19 becoming a global food crisis, our executive director of the World Food Program, David Beasley, stood before the United Nations Security Council and said, hey, This is exactly right. We are looking at potential famines of biblical proportion, was the terminology that he used back in front of the Security Council in April of last year, and warned that this would be a humanitarian crisis on the level that we haven't seen since really the Second World War. And the numbers are starting to play out a bit in that direction. But I just want to take us back a couple years before COVID-19 so that we really understand where we were in the world in the lead up to this pandemic. If you look at chronic hunger, for example, the number of people who, for structural reasons, whether it's poverty, marginalization, inequality, people who are not getting enough food day in and day out, those numbers from the period from 2000 to 2015 were really on a steady march downward. In that period, which coincided with the Millennium Development Goals period, we were able to pull about 200 million people out of extreme hunger or chronic hunger in that period. And that brought that number down from 1 billion people to about 800 million. In the last 3 years, and again, it's 2020 and 2021 now, in the last 3 years, those hunger numbers, which should have been continually marching downwards, have been moving in the wrong direction. And they've been moving in the wrong direction for a couple of reasons. We'll talk about these a little bit in detail, but there has been a dramatic rise in the number of conflict events around the planet that organizations like the World Food Program are responding to. Those conflict events, when we have conflict and war, the inevitable aftermath of that is poverty and hunger, and that's playing out day to day in critical emergencies around the planet. The other is increase in climate-related extreme events. You look back at the early 1990s, and WFP would have been responding to about 90 or 95 climate-related extreme events, the sort of tsunamis, heat waves, prolonged droughts. Today, that number is closer to 215 events of that nature in a given year. So the climate events and the sort of conflict, the rise in man-made conflict, especially between non-state actors and other non-state actors or non-state actors in the state, has really caused an increase in hunger numbers in recent years. So that's one way to think about the trends. The other way to think about hunger is in the acute sense. And this is really WFP's business, right? Acute hunger isn't necessarily driven by these structural factors that I was just talking about, but, is more driven by a shock event, whether it's a climate-related extreme event or, conflict situation that pushes people into a situation where they don't know where their next meal is going to come from. So acute hunger is really the sort of hunger that WFP spends its days trying to fight. And from 2015 to 2019, before the pandemic, the number of hungry people, the number of acutely hungry people, these people who need emergency intervention to save their lives, had increased from about 80 million people to 150 million people. And again, main drivers of that, conflict and climate-related extreme events. So everything was trending poorly before COVID-19 even struck. And that was the context that we found ourselves in at the start of 2020. Now we're starting to see pretty massive estimates for how this COVID-19 pandemic is going to compound those existing trends and make things much, much worse. The International Food Policy Research Institute is suggesting that we're looking at about 150 million people pushed into poverty and related food insecurity because of the virus. We've got about 160 million on USDA's projections that were just released at the end of last year. They put out an annual report on the state of global hunger that comes out in August. They amended that report to suggest the situation was much worse than they imagined and came out with this 160 million people figure. WFP, my own organization, we are suggesting that 135 million people who are going to be pushed into the category of acutely hungry. It seems less than the others, but it is a different measurement. Again, it's acute hunger. It's people who don't know where that next meal is going to come from. 135 people who are really, literally marching to the brink of starvation. It's a pretty tragic situation because of COVID-19. And you can imagine, and this is the case with most issues of global consequence, but vulnerable populations around the planet are going to be the ones who are disproportionately impacted by the impacts of food-related or hunger as a result of COVID-19. Right, the Lancet put out a study that suggested we were going to have between 6 and 7 more million children under the age of 5 who were suffering from a severe acute malnourishment, or what we call wasting. Wasting is when the body eats away at tissues to try to keep critical organs alive. It's a terrible situation to be in, and we expect another 10,000 children will die each month because of that terrible condition, because of the impacts of COVID-19 just this year. So again, COVID-19 is touching in really vulnerable places, in the most vulnerable populations, and it is exacerbating existing hunger emergencies around the planet. And we're going to talk about specifically why, but I do want to mention that we're also in a situation this year because of that exacerbation, because of what COVID-19 is doing to emergencies around the planet, where we are looking again at the prospect of 4 simultaneous famine events around the world, in Yemen, in Northeast Nigeria, in South Sudan, and in Burkina Faso this year. These are countries that were suffering from conflict-related hunger prior to COVID-19. Access issues have gotten even more difficult in those places. Fighting has increased during the era of COVID, and the numbers are only climbing. Behind these 4 countries, we've got between 16 and 22 other nations who are one step behind, who, given a turn of events, would also find themselves in famine status. And as a humanitarian organization, we don't use the word famine all that lightly. It's something, it is a tool of last resort. The criteria to meet famine is extraordinarily high threshold. And so when we start to talk about 4 simultaneous famines, or the possibility of 16 or 20 other countries joining behind, it is a very severe situation and wholly unprecedented. Back in 2017, the last time that we saw these sorts of 4 converging famines, we never expected that would happen in the first place. We certainly never expected to see 4 simultaneous famines again. And yet here we are at the start of 2021. So back in March, when Dr. Fan was writing about the prospects of this becoming a hunger emergency, we started to see headlines like this. We started to see headlines suggesting that global food security was going to be really impacted by the virus. We started to see evidence of countries hoarding and keeping food close. And I think in the United States in particular, given our own experiences going to the supermarkets at the start of the pandemic and watching supply chains have to shift so fundamentally from institutional providers of food to supermarkets and other retailers, and we were looking at empty shelves and we were seeing hoarding, it was naturally intuitive for us to suggest that, well, global hunger that we're experiencing around the world today is going to be the product of supply chain breaks and production losses. And that really isn't what we're seeing today. If I advance the slide again here, and you got a preview of this, you look at global cereal production around the planet today, and we have massive amounts of food still available. 2021 this year is going to again set a record for global grain production. This is a sort of maize, wheat, rice that 60 and 70% of people rely on around the planet to meet their dietary requirements. These things are still being produced at very high levels, and they are being moved around still relatively efficiently, despite the COVID-19 pandemic. And we'll talk a little bit about some border closures and issues that we've had in moving food. But the main story here is that we have still enough food around to provide every single man, woman, and child with about 3,000 calories every single day. There is plenty of food to go around today, and it is moving relatively efficiently. And in fact, when you look at global food supplies and global trade, and we probably move $4 or $5 trillion in agricultural product in a given year. If you look back at 2007 and 2008, just ahead of the last global recession that we faced, we saw in that period about 33 countries who went into a sort of a panic mode and when it comes to protecting their own domestic food security. And we saw 33 countries put in export restrictions of foodstuffs and predominantly grains that represented about 25% of the total global market for grain movement. And so that was a kind of high watermark. And what we saw as a result of that was food riots in about 40 different countries. We saw 2 governments toppled in that period because of that. But to give you a sense of how well markets are actually functioning during COVID-19, at the peak of the pandemic in April of last year or May of last year, we had about 17 countries as a high watermark, representing 5% of global grain. So we did learn some lessons from the last time we found ourselves in a very precarious global situation like this. And export restrictions never really manifested in the way that they did just 10 years prior. And so that is kind of a good news story out of here. This isn't to say that we're not seeing some slowdown in the way that food is moving. The image on the left here is I think pretty reflective of situations that WFP has seen on the ground over and over again. This is trying to move food or supplies over border crossings inland. Those situations became pretty precarious. We found our own vehicles at WFP in pretty sizable 10 kilometer, 15 kilometer lines at border crossings. So there was some slowdown in the movement of food and other commercial goods. And there was also, at harbors and major ports, most food today still moves by cargo ship. There were several quarantine measures in Yemeni ports, for example. WFP was waiting for 2 and 3 weeks at a time for quarantine measures to be able to unload their ships. And so this isn't to say that everything is working perfectly in the global food supply chain, but it isn't necessarily the main driver of why we're seeing hunger go up in this period. The real reason is that the economic consequences of lockdown have really damaged people's ability to afford food in markets for a variety of reasons. And so this is a crisis of food access. It's not a crisis of food availability. Food is still moving, food is still available. What is not happening is people are not having the ability and the purchasing power to be able to gain access to it in their own domestic markets. And that's, here you're seeing a quote from our chief economist, who's suggesting the consequences could be worse than the disease itself. And I think that has panned out over the last 12 months. Global economy, and you will all have seen estimates of this, I'm sure. Global economy is estimated to contract this past year between 4 and 6%. The 5.1% projection you see here is a product of the World Bank. But of course, when you lose this much of the global economy, you have an equal loss in income, especially in vulnerable places. The International Labor Organization is suggesting that we've lost the equivalent of about 500 million full-time jobs. You imagine the working hours associated with that as a result of lockdown measures and a result of the restriction of movement of goods and people, especially in developing countries. Lower middle income countries were particularly affected by this. So you look at a place like Latin America, for example, where their economy, I suspect, will contract by over 12% this year. I think 11.4 according to the latest projections. And so this is a global average. Certain regions of the planet have been hit particularly bad. We saw an associated rise in hunger. We saw a 4-fold increase in acute hunger across the Latin American region as a result of this and the contraction of the economy. So in Latin America in particular, the rug has really been pulled out from under the middle class there, and people, as a result of restrictions in movement and loss of jobs in the informal sector, purchasing power has fallen pretty dramatically. So COVID-19 is disproportionately impacting populations, economically speaking, that are dependent on extractive industries, the sort of oils and other raw materials common to places like sub-Saharan Africa. Folks that are reliant on imports, food imports, even though for the most part food is moving pretty effectively on international markets. It's also affecting countries who are reliant on remittances, large informal economies, places that are lacking the sorts of social protections that developed countries are able to scale up during emergencies like we're facing today. And then, of course, speaking to the hungry getting hungrier and poor getting poorer, places that were already suffering from extreme poverty and suffering from malnourishment, those places are on far worse footing now than they were at the beginning of the crisis. So let's look at some of these just in quick detail. This is a map of crude oil prices from last year over the month by month food oil prices. Just looking here that, when we were paying, if you recall, back in April and May here in the US, you may have fueled your car up for $1.25 or $1.50 a gallon in April and May, but there was a pretty tremendous price to pay for that on the oil exporters side of things. And so you look at countries in particular like Nigeria, Angola, Algeria, these are places where 70 and 80% of those economies were totally dependent on crude extraction and export markets. In those places, a huge loss of foreign reserve meant that these net importers of food weren't able to make good on contracts to bring food into the country. And so if you look at a map of food dependence in terms of import dependence, and you look at a map of global hunger, they look very similar to one another. The places around the world that are already unable to provide for their populations or to buy food on international markets and bring it in were those that were disproportionately impacted by these challenges in importing food and the sort of loss of foreign reserve to be able to do that. The other countries that were really devastated, and another reason that we saw global hunger rise so much over the past year, was this fall in remittances. You probably have seen this figure from the World Bank. They were suggesting remittances. So this is folks who are earning in one country and sending back to their country of origin, to their families. Those remittances would fall by about 19.5% in 2020. It hasn't panned out completely, mostly because there's many folks who are earning and sending remittances back to countries of origin were part of essential parts of the economy. There were a lot of people that we leaned on who were remittance senders who were still participating and still actively working throughout the pandemic. Lots of questions about social justice around that very fact, but still, remittances have fallen off in a lot of places. And you look at a country like Nepal, you look at a country like Tajikistan, you look at a variety of places around the planet, and these remittances can account for between a quarter and a third of GDP in those countries. And so you can imagine what that does for people's purchasing power and their ability to go to the market and buy food. And it matters in particular because in developing countries, we have a very different relationship with food and our kind of household income, right? Here in the United States, the average person or average family spends about 10% of their family income on food. In low-income countries and some middle-income countries, that's over 50%. And during the COVID-19 pandemic, that percentage of household income on food actually rose pretty substantially. So every single year, the World Food Program does an assessment of, I don't know if many of you have heard of the Big Mac Index, but it's essentially an assessment of purchasing power parity that talks a little bit about the relative costs of a similar product across different markets. And WP does this assessment every year with a kind of plate of rice and beans, which is a staple product that we deliver in a lot of different places. In addition to the kind of loss of income in families, there was also an increase in the price of food in a lot of places because of COVID-19, because of restrictions in movement of food, or because of war premiums and conflict premiums that people were paying. So, big finding here is that we've got a huge number of countries where, if you were a New Yorker and you were paying $1.25 for a simple plate of rice and beans, if you were paying a similar percentage of your income for that same plate in a place like South Sudan, you'd be paying closer to $400 for that meal. So you can tell that this question of food access is really top of mind for organizations like WFP. Again, this is an availability thing. This is a question of, can people afford the food that is on market shelves because of currency devaluations, because of these conflict premiums, and because of the loss of their own incomes. And this is really what's driving the hunger problem today. There's also a government component to this. There's a lot of places where WFP is working in the kind of sort of most difficult places on the planet where governance is lacking in a lot of ways. Budgets are pretty small. There's a lot of reliance for donor support to budgets for essential services. In the United States here, in the aftermath of the pandemic, we rolled out $3 or $4 trillion in additional protections through stimulus bills and supplemental appropriations that allowed us to scale up our social safety net systems in the U.S. In many places around the world, only 20% of people have access in low-income countries to those same sorts of safety nets. And so not only did they not exist, but they couldn't be scaled up even further because of the sort of budgetary constraints that many governments found themselves in. So these social safety protections really, I think there's a bit of a good news story here in the sense that the World Food Program has been approached by about 50 different countries to help stand up and scale up social protection programs as a result of COVID-19. but they're still insufficient relative to need. I think the average person, the average country, low-income country, developing country, spent on average $6 per capita on social protections after COVID-19. You can imagine, relative to what the United States was able to roll out in response, whether it was a $1,200 check or a $600 cash transfer, or unemployment plus ups, SNAP and WIC programs, the responses were pretty sizable. So these protections don't exist in a lot of places where the World Food Program is working. So those, I think, are the kind of big picture questions around the impacts of COVID-19 on global food security and some of the major drivers. Again, it's sort of loss of remittances. It's the loss of foreign reserve from extractive economies. It's just the breakdowns in supply chains in countries. All of these things are the things that are starting to contribute to increased food insecurity. But there's also some questions about, the sorts of things that people are consuming. When you have a loss of income, generally speaking, families turn towards more highly processed foods. They move away from fruits and vegetables, which tend to have a higher price tag per unit of calorie unit. And so what's happening now, and I don't think we totally have the full impact of this just yet, but we are seeing an increase in highly processed purchases in a lot of different places. And so you will probably see a rise in hidden hunger as a result of this. Hidden hunger being the sort of loss of critical micronutrients in someone's diet. I suspect that we will see, as time goes on and we have a chance to reflect and look back on this, rises in vitamin A deficiency, zinc, iron. We'll see rises in anemia, variety of nutrition-based illnesses that result from poor diets. A lot of this will be traced back to people's purchasing power and their inability to buy the food that they would have otherwise purchased, or make the right decisions when it comes to what they're consuming. So I think we're early days here. These are two studies that have already starting to look into this. There will be more, I think, as time goes on. The other sort of element to the COVID-19 and global food security that we should be talking about, of course, is the impact of people who are compromised nutritionally and their susceptibility to viruses and diseases. As we look back, of course, on previous incidences, and every single time that we had an incidence of a zoonotic disease outbreak, like a sort of SARS or MERS or Ebola, there were pretty severe consequences for people who started out nutritionally compromised in any way. In fact, some of the early evidence we're seeing out of the Ebola virus in 2014 and previously in 2011 is that people who had poor nutritional status going in had lower rates of survivability from the Ebola crisis. And that's something that we're looking at in terms of COVID-19, but don't really have a lot of evidence around or for right now. This isn't a wholly understudied or under-researched area, though. I mean, we have a lot of evidence about HIV patients in particular needing to have proper nutrition to make antiretrovirals work effectively. The sort of nutrient absorption in HIV patients is pretty severely limited. And energy intake is about 10% higher than a healthy person who isn't suffering from that virus. And so sort of HIV health and hunger nexus is one that's pretty well studied and understood. For COVID-19, there's also increasing questions about vaccine efficacy among malnourished populations. And there's not a lot of work on this yet either, but I think it's just starting to emerge. There's been some studies linking obesity to poor vaccine efficacy for SARS and MERS and other H1N1. And we're starting to see some research into this already on COVID-19. There's some research out there, again, pretty scant on nutrition, vaccine efficacy for common vaccines, sort of influenza vaccine and tuberculosis and others that are administered in the developing world. And while it's generally true that malnourished populations, especially young people, are able to mount some sort of immune response when they're vaccinated, there are questions about the sort of long-term duration of that protection, the magnitude and power of that protection, and whether it's compromised relative to healthy individuals. So I think these are some early questions that are coming out, but I kind of throw them up here as fodder for conversation more than anything else. But so that's kind of the overview I wanted to provide you with. But maybe I'll leave you with this, and this is a comment from one of our support staff in Liberia, and kind of comparing what's happening here in COVID-19 to what is happening in with Ebola in previous years. And he commented that with Ebola, it was like your house is on fire and neighbors rushed in to help you. With COVID-19, everyone's house is on fire. And I only bring this up because from a donor fatigue standard and perspective, I think we have some really hard questions that we're going to have to ask ourselves in the next year. You know, support for the World Food Program has remained strong from the U.S. government in this past year, but we've also spent $3 and almost $4 trillion domestically to respond to COVID-19. To what extent is there appetite to continue to look across and beyond our borders at questions of other countries and their vulnerability to COVID-19? You know, what is going to happen ultimately with instability around the planet? Are we going to see a rise in violent conflict because of these sort of long-term impacts of hunger and instability? Anyway, I bring this up again as kind of fodder for conversation, and maybe you have some questions or comments in this regard. But I think the battle for funding and donor fatigue will be very real in coming years. And the question is can we get our houses in order domestically fast enough to be able to prevent others from collapsing in the coming months? So maybe I'll leave it there so we have plenty of time to ask some questions and dive into some of these areas in specific.
Thank you so much, Dr. Silva. And I open the floor. Please feel free. You can open your mic or throw a question in the chat. I know there is already, I think, maybe 1 or 2 questions. Somebody must have. Do you see that?
Yeah, actually, there's one in here, Juliet. I see one about from John about over what time period are those COVID impact projections. And most of those COVID impact projections were actually retroactive through last year, so during 2020 itself. Now, WFP's number, the 135 million, is a little bit different. That's more of a forward-looking projection. We expect that 135 million additional acutely hungry people to be added onto our rolls over the course of 2021, so this next year. So some of them are backward projections, and WFP's number is a forward projection.
I have a question. You explained that supply chain challenges such as decrease in remittances and increased traffic barriers have been one of the greatest causes of global hunger. I was wondering what other supply chain challenges. I was wondering if they have been political, governmentally like challenged in terms of, because you work in a global organization with many different countries. Has that been something you've seen?
You cut out a little bit in the middle, but you know, I would say the major supply chain challenges have been domestic. You know, this sort of international, like I mentioned, stocks are good, and the movement of food from major bread baskets in one part of the world to other parts and consumers and where the demand is in other parts of the world has been quite good. But where the slowdowns in the supply chain have happened are really domestically, right? It's at the ports where our ships are waiting to unload and having to quarantine a period of time. And then it's those cross-border checkpoints internally where things have slowed down as well. So if you're driving from Uganda to Kenya, for example, and you're having to be checked for a fever, or you're having to undergo sanitation measures at that intersection or that border crossing, those have really slowed down the movement of food. The other kind of major supply chain question that has yet to be answered is, you know, global markets for food where that are very westernized, where you have industrial agriculture producing large amounts of food that get moved over to a supermarket, for example, where people eat, is, you know, that only happens in about 5 to 10% of economies in sub-Saharan Africa. Most of the time it is small scale producers producing a subsistence livelihood. If they're lucky, a little left to go to market, and then a series of small businesses help to market that product and intermediaries. And in those places, it's not clear whether production is going to continue as normal for a lot of those smallholder farmers, or whether they are also going to suffer from tremendous income losses that are going to mean they're going to be eating seed stock, for example, to survive and not planting for next year. We're not sure whether we're going to see a tremendous fall in productivity in those places that isn't very visible right now because of data gaps. So we may have some domestic supply problems on the production side that we're not having globally in these kind of more local informal markets. I would say that's another supply chain challenge that we're facing. But I don't know, you cut out, so I wasn't sure if I totally answered your question or not.
Yeah, that was definitely really helpful in helping me gain perspective on it. Thank you.
Chris, I see your hand is up.
Yeah, thanks, Juliet. Chase, thank you for that really sobering and discussion. You know, a few of us in the audience are physicians. We went, in going to medical school, you're taught when you give a person a drug, expect side effects, and some of those side effects may be lethal. I think in public health, we don't understand that message very well. And a lot of what you present is not the result of COVID-19. It's the human reaction to COVID-19. And I really think that the data that you have needs to be turned around and put back to say, did we do the right thing in response to this pandemic? If more people are dying as a result of starvation than dying of COVID-19, we haven't done the right thing. So I wonder what your thoughts are there.
Yeah, I mean, this is the existential question of our era, I would say, and from WFP's perspective, I had a tough time with it. Frankly, early on in the pandemic, we were starting to hear we had the president of the United States, for example, talking about the medicine being worse than the disease, and that rhetoric, I started to hear being repeated by international humanitarian organizations as well, who are dealing with these lockdowns. Now, it meant something very different, I think, in the domestic context in the U.S. than it did internationally. But nonetheless, you had to wrap your head around those two separate ideas. I don't claim to have any answers to that existential question, but I will say, I mean, the evidence that we have and the experience that WFP has had over the past year has been that lockdowns, restrictions in movement, loss of income, loss of employment, these are the things that we know have been driving increased levels of food insecurity around the planet, and putting us in these really unprecedented situations. And so, it's hard to argue with the fact that the economic impacts have been what it really is driving this. And like I said, I don't want to comment. I don't want to get too political in this. I don't want to get too existential in this. But it is a very fair point and well taken.
The other thing that I would add is when you have a lockdown or reduce movement of people, you quote unquote flatten the curve, but you also prolong the epidemic. So what you're essentially doing is prolonging the problems that you're going to be battling. Now, I don't know what the right answers are. Hopefully the vaccine and the distribution of the vaccine will pay off, and it may roll through the economies of different countries, but I'm not sure that we took the right and best steps. I think early on, yes, when we didn't know anything about this virus, the right thing was to, withdraw and reduce the trend. But as we learn more, young people have less impact from the virus than older people, and that should have informed how we, responded, and that total lockdowns probably weren't necessary.
Yeah, I mean, you look across sub-Saharan Africa and you have the youngest population on the planet, of course, and you've got relatively huge geographies at play there that are pretty, apart from some mega cities in just about every every country, you've got mostly sparsely populated areas. And so, from that perspective, of course, the sort of lockdown measures may have been aggressive in those places, but hunger is not a sort of thing that, the sort of sudden shock event certainly can drive somebody to the brink, but these economic drivers of food insecurity and hunger were slow rolling. People go through a whole series of coping mechanisms before they starve. Selling off assets, it's whatever, and then you get to the situation where you're severely malnourished and your body has nothing else but to eat away at itself, and that's what so many people have suffered. But it didn't happen overnight. I mean, the longer we have these people in lockdown situations, the longer people are unemployed, the longer tourists aren't visiting countries in the developing world, the longer that economies aren't exporting raw materials because demand is down, the longer these folks are going to be in those situations. Now, you could argue, I think, pretty reasonably that the international response from donor governments was insufficient to meet the scale. And you could probably say that, look at our packages, our supplemental packages here in the United States. We've gone through 3 or 4 cycles of supplemental funding domestically. We haven't allocated more than a few $100 million in international funding. The last package offered up maybe $4 billion to scale up COVAX. Unclear that those dollars are actually going to make it there yet. But we hadn't seen anything to plus up our food assistance programs this past year. So WFP, I talked about a $6 and $7 billion budget shortfall this year. That has a lot to do with donor countries trying to put the fires out at home, but not investing enough to be able to protect people while they were in lockdown in these developing countries. So you could argue that lockdowns were probably to flatten the curve were warranted in a lot of places, but certainly needed to be met with social protections and needed to be met with donor funding to be able to provide people that sort of short-term needs, so that we didn't have so many people falling into severe hunger like we're experiencing today.
Yeah, it seems like wealthier countries should have looked at supply chains, some of which reach into these more, low-income developing countries, and supported those supply chains, and that might have been a better solution.
Well, we may have shot ourselves in the foot a little bit too in suggesting that everything was working pretty well in terms of global supply chains, because there was nothing to suggest that it wasn't. All the hangups were happening. We could get food to market, it turns out. People just couldn't afford it. And so, maybe we didn't do it. Yeah.
Sorry, I was thinking about supply chains for other goods and services beside food.
Yeah.
I mean, lumber has skyrocketed, and why is that really?
Yeah.
Okay.
Yeah.
I'll wonderful talk. Really appreciate your coming here. I don't want to monopolize the discussion.
Avery is next. We have Avery's hand up.
Yeah, thank you. Sorry, the camera doesn't work on this laptop, but I had the same question as the first person who asked, so I just want to make sure I got the answer right. So you're saying on top of all the people now who are currently being pushed to hunger, there will be 135 million more by the end of 2021?
That's the latest projections, is that, should everything pan out, should we not get the funding we expect we need this year, and other humanitarian organizations, the number of people who are suffering from acute hunger, those people, crisis levels of hunger, will rise from about 135 to about 270 million people over the course of the next year. And that's a projection that kind of a rolling projection. This is something that we have been, the same numbers we've really been using since April or May of last year. The timeline keeps slipping a little bit, but we're still expecting those numbers to be achieved if funding isn't raised.
Thank you.
Chase, I have a quick, maybe make a comment on the point that you made, that there's plenty of food. So the problem is not the food availability, but it's access. So I wondered what the situation looks like in terms of what the domestic availability of food is. So some countries are able to produce their own food. They are largely agricultural, Uganda being one of them. So yes, there's the external one where people have to buy food, but how much is the domestic production able to close some of that gap? If you make some comment on that.
Yeah, of course. Uganda and other countries have done a really good job in increasing agricultural productivity over the past 20 years. A sort of new green revolution in Africa, I think, has taken some of the lessons learned from South Asia and Western style agriculture and tried to scale those models up. And you see that happening in a lot of places across sub-Saharan Africa. But still, the continent itself is a net importer of food, despite those increases. And I don't know what Uganda's situation is specifically. I suspect it still is importing a certain amount of foods that it's either not, it doesn't have the capacity or kind of comparative advantage in producing. But to the extent that domestic production can help close some of these gaps, I mean, it's going to be needed over the next year. Like I said, I think. The question is whether smallholder farmers are going to continue to produce, or whether they are eating down seed stock, or whether they are selling off productive assets in order to survive. And the question is are these people are in a position to produce domestically to start plugging those gaps? And I just don't know that that's the case. There's some questions about, food is moving pretty well across borders, but I know that there's been breakdowns in the movement of non-food commodities like fertilizer, for example, or seed inputs. And the question is not only are the people capable of working in the fields to produce this, and is there going to be proper inputs to be able to meet the production needs of smallholder farmers? So I think all that's to be answered still. But yeah, I mean, to the extent that we can increase agricultural productivity, I think every single major donor out there is trying to figure out a way to leave countries self-sufficient in their wake, and even WFP is spending a lot of time working with smallholder farmers to create markets for their product and buy some of our food assistance from smallholder farmers. And we're also trying to figure out ways to rejuvenate kind of degraded landscapes so that that food production can increase in a lot of places. So I think it's a fair question. Right now, though, things are on fire. And this is a question of urgency and now, and needing to get assistance in the short term, whereas these conversations about agricultural productivity are 2 and 3 years out, which we need to be having those conversations now, so that we don't have a long tail of COVID that manifests through low productivity as well. But right now, the WFP is concentrating on getting food to those in need.
Wow, thank you so much. I think we've come to the end of our time. I wish we had more time to, delve into some of the details of this, but thank you so much, Dr. Silva, for this very informative talk, definitely very enlightening. And I would like to thank the audience for coming and joining this seminar. But before you leave, we have just one quick announcement from the Global Health Union. The students have something to announce about the upcoming case competition. So please stay on, if you don't mind, for just 1 minute, and we'll have the announcement.
Yeah, hi, I'm Mary Ann. I am in charge with Hermela and Emma, who are also on this call, of the case competition with Dr. Davis Olwell. And we've been working for the last year on writing this, and we just thought this was the perfect opportunity to announce our topic verbally, since after that amazing talk, because it's really related. And our topic has to do with childhood malnutrition in the Northeastern District of Kenya. So competitors, which I see a lot of competitors on this call, so thank you so much to our competitors for coming to this, but competitors will be taking on the role of consultants to plan a program for a big foundation that's giving them a budget of $10 million and a timeline of 3 years to impact childhood malnutrition in the Northeastern District of Kenya. So hopefully you can use a lot of what we talked about in this talk for the case, because you will need to take into account COVID-19, a lot of the climate issues going on in Kenya, and those types of things. So, yeah.
Wonderful. What perfect timing and nice dovetailing of things. And that's what makes it even more exciting. So thanks, Mary, for making that announcement. And if there are no other announcements, comments, we'll sign out and just give a hand clap with the reaction to Dr. Silva. I'll go fast.
Thanks all. And as you're prepping for the competition, please feel free to reach out and we can direct you guys to some resources as well that will help. I'm hopeful we can be of assistance there. So thank you so much. Really appreciate it.
Thank you so much.